AskR did by professional song 419. What are some gruesome facts about pregnancy, childbirth, postpartum that not many people know? First trimester miscarriages are way more common than most people think. 1 in 4 pregnancies terminate before 3 months. There is nothing that can be done for a blighted ovum. They just happen. This is what happened with my second pregnancy. Went to see the OB-GYN at 8 weeks and there was no little white blip, heartbeat, flashing in the ultrasound. The doc said it had the size of 4-week embryo and was dead. Miscarried a week or 2 later. Suck to the nth power of suckage. After birth, I sweat so much at night that I would wake up soaking wet from head to toe for the first week or 2. I had the exact opposite. I would wake up absolutely frozen and I hate being cold. Still smelled like ass though. Nobody warned me that my insides would feel like they were falling out when I stood up the first few days after birth. This was going to be my comment. Imagine weights hanging on your intestines, lungs, stomach, etc. as they try to remember where everything goes now that the baby is out. Sometimes it takes weeks to be able to stand up, sit down, walk again without a ton of pain. No one fucking told me that the first time. I was so focused on how the actual birth might be painful, had no realization that for over a month afterwards I'd be in danger of burning to death if the house ever caught fire because I could barely walk. I had a forceps birth. Doctor said I looked like I had been beaten with a baseball bat. When I walked it felt like I was wearing a giant diaper. I had to walk with my legs spread. Couldn't sit for the first 2 weeks, then had to sit on a donut for the next 8 weeks. I didn't have control of my bowels for the first few days, which was mortifying. I thought it was just me. When I went for my checkup, one of the first questions my doctor asked was, "Do you have control of your bowels yet?" Like WTF? Why didn't someone tell me to be prepared for this? Passing clots the size of rocks. And bleeding for weeks after. When I was in the hospital for my C-section, they put the little pan in my toilet to monitor everything that was coming out, and told me to alert them if I had a clot bigger than a lemon. A goddamn lemon. I was a little horrified. The thing that frightens me the most is pelvic floor issues. Imagine suddenly no longer being able to control when you pee. Postpartum incontinence is no laughing matter. No, seriously, don't laugh. It'll make you pee. Can't believe this hasn't been mentioned. Hemorrhoids. Often women don't know they have them from labor due to the swelling, but add it to the list. Yes. The whole nobody tells you shit yourself thing was old news to me. Most of the nobody tells you normal crap was old news to me. That I would still have hemorrhoids 11 years later? Nobody mentioned that crap ever. And it's common. Postpartum depression is extremely dangerous and can last for months after their birth. After my twins were born, my wife had a complete personality change. She became suicidal, and at times abusive to me. At one point she ran away from home. I found her 2 states away. Her brother had to bring her home. Things got really, really bad. The twins are 5 now and she's the person I married again. She doesn't like to talk about those times. The only thing she'll say is it was the darkest time in her entire life. My personality changed completely after my son. For the first time in 10 years I feel like myself again, only because I'm pregnant and had to switch meds. But it seems Prozac is my thing, so I'm totally fine with it. They go full crazy pushing your stomach after birth to make sure everything is out. I read some books but no one prepared me for that. It was like having another baby. I had forgotten about this until I read this comment. I would dread the nurses coming in the room. Also, the amnesia was real. I forgot a good bit, not only about the birth but a good chunk of my college degree as well. The feeling of your organs going back down after they were cramped up for so long is a bit frightening. Especially the lungs. Standing up I could feel like they were weighted down. People talk about cracked nipples and painful latching while discussing breastfeeding, but nobody talks about your uterus contracting during the first days of it. OMG. I'm 6 days postpartum and the uterus contracting thing started today after I pumped for the first time. I had read about the contracting in passing thankfully, but honestly more than the pain, it was a bit psychologically triggering so recently after birth. Also somehow one nipple is wrecked, but the other is holding up like a champ. I'm so confused. Contractions don't finish after labor. You have the afterbirth pains to look forward to when your uterus returns to its usual pre-pregnancy size. That get worse with each successive pregnancy. The umbilical cord is dense, tough, and sinewy. When you cut it you end up sawing a little with the scissors. I don't know what I expected, but that was weird. Postpartum mental illness is a thing, and it can be horrific. When I was 20, my best friend married a guy in another country and was having a baby. I visited to help out. It took a day or two, 7 postpartum, for me to realize something wasn't right, and that she needed professional help. She was seeing and speaking to people that weren't there, freaking out about her baby being missing, when she was holding him, etc. That was my first experience with postpartum psychosis and it was scary. PPD is bad enough, but childbirth-induced schizophrenia. My friend never really recovered, even with medication and support. She passed in 2020, complications and contraindications with a virus, not COVID, and her meds. My wife's placenta wouldn't detach after the birth of our daughter, so the nurse just went up in there and got it out. I was oohing and ahhing over our new baby girl and I look over to see someone damn near elbow deep treating my wife like a sock puppet. It was so jarring. Mothers are so damn tough, dude, it's unreal. My mom had to have the placenta ripped out of her for all 3 kids. How she even allowed a second, me, is a fucking mystery to me. When she tried the whole "when are you having kids" thing on me a few years back, I was just like, never have you heard your own stories, goddamn. The leading cause of death in pregnant and postpartum women in the US is homicide. Started a new job in the NICU last year. Boy was it a rude awakening. I had no clue how many women and sometimes newborns experience abuse. We are a lockdown unit. Other facilities will send their newborn patients to us to protect them from an abusive parent. I've lost count of the husbands and baby daddies we've had to call security on and ban them from the unit. It's so obscenely common that we have sticky notes at the front desk to keep track. I've lost all respect for humanity at this point. Seemed like it was taking a long time for my OBGYN to stitch up tears and an episiotomy. I whispered to my L&amp, D nurse, if it normally took this long. She whispered back, girl, you're torn from clit to shit. It's gonna take as long as it takes. Haha, that L&amp, D nurse sounds great. I was stitched for over an hour, and when I asked what was going on, my OB told me she likes to leave vaginas looking the way she found them. Hyperemesis gravidarum. Terrible. I lost 50 pounds during my pregnancy from it. I have a friend who had that. She was in hospital more than she was out. When you get a C-section, they may have to take the section of intestines covering your uterus out of your body. Like, it's just sitting in a bowl next to you. Then once the baby's out and your uterus is stitched back up, they just pack your guts back in and sew you up. Usually it's just pushed to the side, though. Also, your uterus is pulled partially out of your abdomen so they can deliver the baby. And then your guts will rearrange themselves back to where they should be and you can feel it. You will need to prep yourself for the second birth. What is that? It's when you have your first full bowel movement after. If you had a C-section, gently push with your flat hand on the incision while pressing to poop. It will make it so much easier and stop the feeling of your bowels falling out. PTSD as a result of a difficult birth is surprisingly more common than you think. I still suffer symptoms even now and my daughter is now 10. My best friend had an awful childhood that she has mostly repressed, until going through a traumatizing birth. Everything came back up to the surface and she got hit hard with PPD and PTSD. I spent a lot of time at her house the first 6 months helping to look after her daughter while she worked through her episodes. I hope you had someone who helped you through your hard times as well and that you're doing okay now. Near the end of my pregnancy I had terrible gingivitis. Apparently pregnancy can cause this, and carpal tunnel in both hands from the swelling that lasted months postpartum. Also no one tells you about the swelling that can happen postpartum. I had a C-section and the swelling in my legs and ankles was so painful it lasted 4 weeks. I could barely bend my knees and my ankles were not existent. If you have labor to full dilation you can still wind up with an emergency C-section. So you don't get the at least you can sit down your baby has a nice round head benefits of not delivering vaginally. If your baby's head is stuck in the birth canal when they do the C-section in these circumstances, freeing it comes with a really juicy squelching pop breaking the suction. Quite unnerving to hear. I was in labor for over 24 hours and had an emergency C-section because I couldn't get past 8 centimeters. During my C-section my baby got stuck down in the birth canal and they were pushing and pulling to get her unstuck. Not a fun time lol. The placenta is the size of a plate and leaves an internal open wound that size that also needs to heal. Edited to @ the responses in shock to this make me really angry about the level of maternal education and care that is being given. It drives me crazy how many people think sex is fine if you feel like it's fine. Before the uterus heals, it could be life-threatening. Preeclampsia can last up to 6 weeks postpartum. You'd be amazed at how many emergency personnel don't know this. When asked if you have any medical history, please volunteer the information that you are postpartum. Don't wait for them to specifically ask steps off a soapbox. Yes. And often you can go directly to L&D if you're less than 30 days postpartum. Instead of the ER, if you think something is wrong, go to the hospital. There's a very high chance that you will poop during the birth. Pushing is pushing. If you don't poop, then it means you are in for a bigger poop afterwards. Speaking of poop, the baby will often poop on you during the skin to skin immediately after the birth. I shit in a Wendy's cup on the way to the hospital while I was holding the top of the baby's head. Now that I think about it, that's pretty impressive.